Welcome to MedX channel. Today we are going to talk about benign prostatic hyperplasia versus prostatic cancer. So don't forget to like the video and subscribe the channel. So let's start. Benign prostatic hyperplasia, it is a non-cancerous enlargement of the prostatic cells, only enlargement. While in prostatic cancer, there is malignant prostatic cancer, there is malignant tumor, which is most commonly adenocarcinoma. And as most of the benign tumors, this is slow progression, and this is rapid progression. It is most common in elder men over 50-year-old. By the way, at the age of 70, there is more than 90% of people have BPH. While in prostatic cancer, it is most commonly in people more than 60-year-old. In benign prostatic hyperplasia, it is commonly in transitional zone around urethra. While in prostatic cancer, it is in the peripheral zone of prostate. Let's talk about this picture. This is the normal urinary bladder and the normal prostate. And in BPH, there is enlargement of the prostate, but with the same cells. There is no variant from the normal cells, but it is more enlarged. Okay, this may lead to compression of the urethra here. If both lobes are enlargement, there is compression of the urethra, but there is no malignant transformation. And as this picture, when there is multiple and variable cells or enlargement, which most commonly adenocarcinoma, there is also compression of the urethra, but with bleeding. It is abnormal cells, and these abnormal cells need to be adapted. There is adaptation which can lead to cancer. Okay, so in the benign prostatic hyperplasia, the most common symptoms, it is the urinary bladder obstruction, which comes with hesitancy, weak stream frequency, and nocturia. While in the prostatic cancer, early symptoms may be hematuria and bone pain. As in prostatic cancer, there is vertebral myths. It connects to vertebral plexus. Okay. In the prostatic cancer, there is symmetrical enlargement. Symmetrical enlargement. While in the prostatic cancer, there is asymmetrical enlargement, as we see in this picture. And in prostatic benign hyperplasia, there is smooth, firm lobes, smooth. And in prostatic cancer, there is hard irregular surface. This is hard irregular surface. So when we use perirectal examination, we find that this is irregular surface, or this is a smooth surface. If it is irregular, it may indicate that it is BPH. May indicate that it is prostatic cancer. And if it is regular and smooth enlargement, this is PPH. Okay. PSA may be slightly elevated in BPH, but it is significantly high in the prostatic cancer. So let's talk about the histology. There is hyperplasia of both glandular cell and stromal component, and in BPH. And in prostatic cancer, there is malignant epithelial cells forming irregular gland, as we mentioned before. There is metastasis in prostatic cancer, as we mentioned, that in the bones by vertebral plexus, and the treatment mainly in the benign prostatic hyperplasia. We can use alpha blocker and the alpha reductase inhibitor, and if it fails, we can go into TURP, transurethral TURP of prostate. Okay, and in the prostatic cancer, it depends mainly on the stage. So I can use surgery, I can use radiotherapy, I can use androgen deprivation by using chemo. In BPH, there is excellent outcome, but in prostatic cancer, it has a good prognosis if it is detected early, as it is slow spread compared to another types of cancers. So let's summarize what we talked about before. This is benign prostatic hyperplasia, and this is prostatic cancer. It is slow progression, and this is rapid. This is usually in the transitional zone, and this is in the peripheral zone. And symptoms, there is mainly obstruction, and here mainly hematuria. But here it may the symptoms of obstruction is hesitancy, dysuria, frequency, nocturia. There is symmetrical. What about enlargement? Symmetrical, regular, with firm surface. Firm, smooth surface. Here it is asymmetrical, irregular, with hard surface. PSA slightly high, but here it is very high. Mets, no, but here it is in the back by vertebral plexus, backbone, which is the vertebrae. Treatment, it is alpha blocker, alpha reductase inhibitor, and if it's failed we can go into TURP. And the treatment here, it is depending on the stage, by surgery, radio, or chemo. The prognosis here, it is excellent. It is good if it is detected early. I hope you could benefit from this video. Don't forget to like the video and subscribe the channel. Thank you.